Hello, my friend Pesapota. I'm representative of Dr. Momo Chaudhary, MSC 007 version Momo. आपसे मी डॉक्टर सोहेल और डॉक्टर मोहम्मद सोहेल. Now my friend Pesapota, how much patient? Yeah, alif lam lam. Yellow sharp yellow mapur log. In case of those patients suffer that private organ disease. We need labology, lab pill or lab for labology purpose, not sexual. Silden up, 50 milligram after consecutive. If you take consecutive, power reduce. At least 3 months. After 3 months, you take that for labology purpose, not sexual. Silden up, world class. If you need the world class company and in your country, which company you select, that depend on you. Generic name Silden apple. Generic name uh, written by the small alphabet in drug. In any drug, you see the what is the trade name below. There is a small letter, is small size name, that is generic name. I say generic name, not trade name. Worldwide, which company is best, or worldwide, all of which company is reasonable price, and country-wise worldwide, take that. Those are my patient. At least after 3 months. Understand? And that is for my patient. And you know that if cordial every day you need, the power will reduce rough and tough situation. Understand? Now my friend supporter, only senior dumping, nothing else. Understand? Only senior adult dose 50 milligram, one tablet before 1 hour before labology. If wife agree, then take before 1 hour. Understand? If activated, then do labology, not sexual. Understand? I think better understand. Now my friend supporter, what is the now in medical science class, what is science? Science is anything, any matter, any science. What is science? Science is anything, any matter, any event, any problem, any occurrence can solve by logic, document, database, mathematical calculation, with improvement, with experiment. That is science. What is medical science? Medical science is a branch of science which can be elaborated about creation like human Homo sapiens. Now we control the BP, blood pressure, without drug policy already. No precaution. You alert about that with suggestion of cardiologist, doctor, cardiologist. Understand? Cardio mean heart, cardiologist. Now my friend supporter, we go to the bronchiology in asthma. Those are asthmatic patients. There is a breath exercise. If you continuously do that breath exercise, by breath exercise, there is a machine, ball and air. You try to do that breath exercise. If you continuously do that, you can cordially. If breath exercise, then you no need to take longer to salbutamol. Those are allergic asthma. That is avoid allergen. Those are not allergic, take salbutamol inhaler. For them, breath exercise. And if you wanted to know the permanent solution asthma, any doctor can know that. Not me. First I say medicine, then say surgery. First medicine is breath exercise, and first remain in your pocket inhaler. Hot when necessary, take a puff. In case of puff, you press that and take a deep breath and remain in 3 seconds. Then in case of inhaler, you not know to utilize that. Take a deep, when press the bottle, take a deep breath for 3 seconds, just like that. Then understand? I think better. Then that is the asthmatic patient. First, salbutamol, aminophylline, theophylline, salbutamol, and rough and tough is Buticort. Those are steroid nebulization given. First, steroid nebulization, reduced dose, tapering dose, then salbutamol, then come to breath exercise, reducedly, with the consent of bronchiologist. If your lung show, chest X-ray show normal, and trachea, ring of trachea show the normal position, and there is a narrowness is reduced, then you can reduce the dose. Steroid to salbutamol, inhaler to reduce inhaler dose. First tapering the steroid dose, then tapering the inhaler dose, then when 1 month without take a inhaler by breath exercise you can remain, but inhaler remain in your pocket. What I mean. Then reduce it 1 month, 2 month, 3 month. How much month without take a single inhaler, single pop-up inhaler? How much time? 1 month, 2 month, 3 month, 4, 5. Continue to do that and with breath exercise. That is the bronchitic patient treatment, bronchology. Any doctor know that without inhaler you can survive. By breath exercise your narrowness clear. The trachea ring narrow, that is the asthmatic patient condition. Fine. And allergen purpose, reduce the allergen. If allergic asthma, reduce the allergen, avoid to allergic food or allergen, avoid allergen particle and avoid allergic food. Now what is the surgery? In case of normal trachea adult ring, see the normal trachea adult ring. Then go to the bronchiologist, those are surgeon, they take that surgery, single surgery, increase the size of trachea. Just narrowness clear. But sometimes what happen, but you must be as a surgeon concerned, if irregularities stop the trachea ring, after that surgery you take the pani, water, clear that, give solid food. The water go to the trachea or esophagus. Try to understand that. And epiglottitis stop the trachea ring. If ring is more in between surgery, the trachea ring is more size and shape. What happens? The food bolus go to the trachea. Patient maybe suffer breathlessness and maybe die. Very much concern about that. How much size and shape of trachea? That much size and shape. How much increase? How much narrowness come? That much. Correct that much, not more. Then a patient can take, that is the permanent treatment of asthma. Now somebody says psychopath, psychomat, because they are not know that policy. They are still now, that is the reason say please jail us. No problem. Before I say that the heart disease, now I see the lung disease. For my patient, if one lung is remain good, one lung is enough to survive. For those lungs patient, if you have two lungs, one lung is 100, one bird's lung is 100, one lung is stopped, but cut down, one lung is enough to survive. Understand? I think better understand. So those are lung patient. If two lungs not work, how you survive? Any doctor, any professor, bronchiologist, not know. Artificial respiratory machine, give the oxygen. In artificial respiratory machine, in feed that oxygen, in ARA, you higher deficiency will give the oxygen. You take the, for that, you give him the, if artificial oxygen machine lungs is not work, then how much work? 20% or 30%, 40%. High deficiency you need mask, oxygen mask, and with oxygen cylinder. Now feed the oxygen cylinder in bag and give the mask. By that patient can survive. If not survive, then oxygen give to the blood. How you give the oxygen blood? If you give oxygen blood, there is a pulmonary embolism occurs. Somebody say. But that patient is not awareness to survive without oxygen. The award is not pulmonary embolism. Award is every cell need glucose. Lungs already cut down, trachea. Now IV route give the oxygen flow and average. What is the flow? You calculation that. Still researchable. IV route, if lungs, two lungs is stop, cut down, then oxygen, without oxygen patient is not survive. Now this patient can die. In that die or do situation, give oxygen in blood. Already oxygen have glucose in blood. In IV saline there is a glucose, and now we need oxygen for ATP. Give oxygen in blood. This is researchable still now for survive that patient, that kind of do or die situation. How much die situation? In syringe there is a syringe. Take the clean air and give the half syringe or 1 cc, 10 cc syringe, give the 1 cc air. Slowly, IV slowly. If there is a leakage in vein, then correct the leakage the vein. If there is an embolism or there is a embolism in brain, correct that. There is a thrombosis in brain, correct that thrombosis. Understand? I think better. That is research about bronchiology. Bronchiology. Any bronchiologists know that all over the world? First class we any cardiologist know that what I say? And what I say, any bronchiologist know that? No. Now you want to understand that is enough to prove that. Now you say any doctor, professor is not no. That is enough to prove that I am scientist, medical scientist. No need another lecture. Try to understand. I think better understand. Thank you very much, my friends. Doctor, those patients, those patients believe me by this is medical. No need to prove that. And all the organization, those are professor, you know that. You can see that I respect all doctor, intern doctor, all medical student, intern doctor, honorarium officer, residency, residency medical officer, register, then assistant professor, associate professor. You decide. You give mark. Understand? And student, also medical student. Thank you very much, my friend. Today is enough from for not medical scientist purpose. This purpose, how much asthmatic patient correct. Normal life lead. You try to understand. First class, how much cardiologist patient without drug survive. How much asthmatic patient, how much survive without drug. You know that. Drug dependency. Try to understand that is for not for medical science, medical scientist purpose. That is for medicine and treatment purpose, for health purpose of service. Medical science is the novel profession. Try to understand. Thank you very much, my friend. Today is enough for medical science class.